people would be independent of political influence, because they're going to be making a lot of very difficult decisions about what are the benefits, who gets covered, what do providers get paid, how much is this going to cost. So the idea is that you didn't want those decisions to be unduly influenced by politics. Unfortunately, I personally feel that they may be a little bit too independent, because they're going to be making a lot of decisions, and I, as a legislature, would not have really the ability to influence it. So I'm a little concerned about how much power this board will have and the responsibility they will have, because if everything envisioned in this bill comes to pass, including Green Mountain Care, about which there are still many questions, this board is essentially going to be running like 20% of Vermont's economy. And I have grave doubts of the ability of any 5 people to really be able to do it. From what I can tell, these 5 people are going to not only need to know a great deal about the health industry, but also have the combined wit and wisdom of Solomon, Oliver Wendell Holmes, and Judge Judy. And I just don't think that, I'm just very, very nervous about that. I did not like making any kind of commitment to a program where we did not know who it was going to cover, how it was going to cover, what the benefits were going to be, and most importantly, how we were going to pay for it.
So what the federal government required was for us to set up this system so that people could go in and have these choices. They could know, okay, I want this type of coverage, and this is how much it's going to cost, and this is how much I'm going to pay for it. And that sounds fine. What the feds also said is you can set up the exchange any way you want. You can reach across state lines. You can get, say, the Northeast or New England to get together and enter an exchange program. When you do that, because you have a larger pool of people that are being insured, usually the rates come down. In Vermont, though, we have community rating and guarantee issue, which means everybody has to have the same policy, and everybody that wants it has to be able to get it for the same price. And regardless of the fact that you have a pre-existing illness and live an unhealthy lifestyle, you're going to pay the same as everybody else. So this exchange that we set up doesn't go outside Vermont. It says we will try for 2 insurance companies to compete against themselves, compete against each other. We'll try. No guarantee that there'll be 2, but we're going to try to have at least 2 insurance companies that are putting this out there for us to be able to look at and purchase if we want. And enrollment won't start till November of 2014. That's when enrollment into this exchange is set to come in, and that's assuming we get the waivers, the federal waivers. The coverage is supposed to begin. You're supposed to, if you bought into this exchange, you're supposed to be getting coverage starting January of 2014. One of the things I found very disturbing is when you ran all the dates and ran the numbers. This is set, the exchange coverage is set to start January of 2014. But it also says once all of the waivers are received, regardless of whether Green Mountain Care comes on board or anything else, once the waivers are received, the exchange is discontinued. It is designed, the exchange, to be a stopgap, to give coverage for at least a short period of time. The risk is that it will drive away insurance, so that even if we can't implement Green Mountain Care, if we can't afford it, we'll have nothing left. I think every one of us up here and probably in this room agree that we have to do something with the healthcare system. I don't think this was the thing to do, but to vote for a bill that we don't know what it's going to cover, we don't know how much it's going to cost, and we don't know how we're going to pay, but trust us, we're from the government, we're here to help, just didn't make sense to me.
And And surprisingly, when we took a look at administrative costs, you would think that the state Medicaid or the federal Medicare programs would have the lowest administrative costs. But those plans that had the lowest administrative costs were the companies like IBM and companies like that really used a business model to keep that administrative cost down. And so they're paying a much smaller percentage of their payroll than small businesses. And we're cost shifting onto those small businesses. Every time government does not properly reimburse providers and hospitals, we cost shift onto those small businesses through their insurance. So that basically any business in the state of Vermont is paying about a little bit more than 30% of what they should be paying because of the cost shift. We've heard repeatedly that there's going to be administrative cost savings by moving towards a single-payer system. You're going to see some administrative cost savings, but you're not going to see the numbers that people are talking about. Why aren't you? Because no matter what, we still have tourists coming to Vermont. Vermont is not an island, we're a state, and people are still going to be coming in. And so you're still going to have someone in the doctor's offices and at the hospitals chasing the dollars. And if you look at Dr. William Schall's report, he talked about a financing tax that was primarily a tax on earned income and basically had an employer and employee side. The employee side, roughly 4%. The employer side, 10 to 11%. And the problem with that, to me, it became very clear that if you have an employer-based payroll tax at that high a level, you're going to do some things to the Vermont economy unintentionally that are going to repeat what happened with the sales tax on the eastern side of the state. So what happened when we put in place the sales tax? We saw our retail business on the eastern side of the state move into New Hampshire. So what's going to happen if we have that large of percentage tax on earned income for the employers? We're going to find anybody that's paying more than $33,000 a year to their employee is going to think about moving. So if you're an engineering firm in Rutland County, you're going to move to Whitehall. You're going to be able to keep your same employees, you're going to be able to keep your same customers, but you're going to avoid the tax completely. And if you keep your Vermont employees, they could be covered. So that's the last thing that we wanted to do. So there's a provision that the overall impact on the Vermont economy cannot have a negative effect. And I think that's important. I think that will force a financing package that will look at not just earned income, but other revenue sources. And if it goes down the road that's been proposed by Dr. Schall, I think everybody should be voicing huge opposition to the bill. We hear a lot from people who want us to go to single payer tomorrow that there's going to be all these doctors coming to Rutland and to Vermont because they want to practice in the system that has that. Now here's the problem with that. What you probably would find is that a percentage of those doctors probably would come here because they can't succeed where they're coming from, because they can't compete in a competitive environment. We don't want that. We want doctors and healthcare professionals that can get the job done and give us quality care.